200 CNA exam practice test. Question 1. What is the function of the left atrium in the circulatory system? Option A. It pumps blood to the lungs. Option B. It receives oxygenated blood from the lungs. Option C. It pumps blood to all parts of the body. Option D. It receives deoxygenated blood from the body tissues. The correct answer is option B. It receives oxygenated blood from the lungs. The left atrium serves as the receiving chamber for blood that has just been enriched with oxygen in the lungs. Question 2. Which chamber of the heart is responsible for pumping blood to the lungs? Option A. The right atrium. Option B. The left atrium. Option C. The right ventricle. Option D. The left ventricle. The correct answer is option C. The right ventricle. The right ventricle pumps deoxygenated blood through the pulmonary artery to the lungs for oxygenation. Question 3. Which chamber of the heart pumps oxygen-rich blood to the entire body? Option A. The right atrium. Option B. The left atrium. Option C. The right ventricle. Option D. The left ventricle. The correct answer is option D. The left ventricle. The left ventricle is the strongest chamber of the heart because it must pump blood through the entire systemic circulation. Question 4. What is the primary difference between arteries and veins? Option A. Arteries carry blood to the heart and veins carry it away. Option B. Arteries carry blood away from the heart and veins carry it toward the heart. Option C. Arteries are only found in the legs and veins are in the arms. Option D. Veins are thicker and more muscular than arteries. The correct answer is option B. Arteries carry blood away from the heart and veins carry it toward the heart. Arteries transport oxygenated blood away from the heart to the tissues, while veins return deoxygenated blood to the heart. Question 5. Which type of muscles can be consciously controlled by an individual? Option A. Involuntary muscles. Option B. Smooth muscles. Option C. Cardiac muscles. Option D. Voluntary muscles. The correct answer is option D. Voluntary muscles. Voluntary muscles, such as those in the arms and legs, are under the conscious control of the central nervous system. Question 6. What structure connects a muscle to a bone? Option A. A ligament. Option B. A tendon. Option C. Cartilage. Option D. Fascia. The correct answer is option B. A tendon. Tendons are tough, fibrous connective tissues that attach muscles to bones to allow for movement. Question 7. What structure connects one bone to another bone at a joint? Option A. A tendon. Option B. A ligament. Option C. A nerve. Option D. Muscle tissue. The correct answer is option B. A ligament. Ligaments provide stability to joints by connecting bones together and preventing excessive movement. Question 8. How does the body produce heat when it is exposed to cold temperatures? Option A. Through sweating. Option B. Through shivering. Option C. Through deep breathing. Option D. Through a decrease in heart rate. The correct answer is option B. Through shivering. Shivering is a rapid, involuntary contraction of muscles that generates thermal energy to maintain body temperature. Question 9. Which part of the brain is responsible for reasoning, memory, and voluntary muscle movement? Option A. The cerebellum. Option B. The brainstem. Option C. The cerebral cortex of the cerebrum. Option D. The medulla. The correct answer is option C. The cerebral cortex of the cerebrum. The cerebrum is the largest part of the brain and its outer layer, the cortex, manages high-level cognitive and motor functions. Question 10. Which part of the brain regulates and coordinates body movements and balance? Option A. The cerebrum. Option B. The cerebellum. Option C. The brainstem. Option D. The medulla. The correct answer is option B. The cerebellum. The cerebellum is located at the base of the brain and ensures that muscle movements are smooth and balanced. Question 11. What functions does the medulla in the brainstem control? Option A. Reasoning and memory. Option B. Vision and hearing. Option C. Heart rate, breathing, and swallowing. Option D. Voluntary arm movements. The correct answer is option C, heart rate, breathing, and swallowing. The medulla is the vital center of the brain that manages automatic life-sustaining functions. Question 12. How many pairs of spinal nerves are found in the peripheral nervous system? Option A, 12 pairs. Option B, 24 pairs. Option C, 31 pairs. Option D, 50 pairs. The correct answer is option C, 31 pairs. The peripheral nervous system includes 31 pairs of spinal nerves that carry messages to and from the spinal cord. Question 13. Which part of the nervous system is responsible for the fight or flight response during stress? Option A, the parasympathetic nervous system. Option B, the sympathetic nervous system. Option C, the central nervous system. Option D, the skeletal nervous system. The correct answer is option B, the sympathetic nervous system. The sympathetic nervous system speeds up body functions to prepare for a perceived threat. Question 14. Which part of the nervous system slows down body functions to conserve energy and rest? Option A, the sympathetic nervous system. Option B, the parasympathetic nervous system. Option C, the brainstem. Option D, the cerebrum. The correct answer is option B, the parasympathetic nervous system. The parasympathetic nervous system promotes the rest and digest response to restore the body to a calm state. Question 15. According to the Omnibus Budget Reconciliation Act, which of the following is a resident's right? Option A, the right to free medical care for life. Option B, the right to refuse treatment and be informed of the consequences. Option C, the right to have the family determine the plan of care without resident input. Option D, the right to have a private car at the facility. The correct answer is option B, the right to refuse treatment and be informed of the consequences. Federal law mandates that residents have the right to participate in their own care and refuse unwanted treatments. Question 16. In the event of a fire, what should a nursing assistant do during the rescue phase of the RACE acronym? Option A, call the fire department immediately. Option B, move any residents in immediate danger to a safe area. Option C, close all doors to confine the fire. Option D, use the fire extinguisher on the flames. The correct answer is option B, move any residents in immediate danger to a safe area. The first priority in the RACE procedure is to rescue and remove people from the immediate threat of fire. Question 17. What does the letter A stand for in the fire safety acronym RACE? Option A, in the nozzle. Option B, assist the visitors. Option C, alarm, by pulling the fire alarm and notifying the switchboard. Option D, apply water to the base of the fire. The correct answer is option C, alarm, by pulling the fire alarm and notifying the switchboard. The second step is to activate the facility alarm system to alert others of the emergency. Question 18. What does the letter C stand for in the fire safety acronym RACE? Option A, call the family. Option B, clear the hallway. Option C, confine the fire by closing doors and windows. Option D, check the room for smoke. The correct answer is option C, confine the fire by closing doors and windows. Closing doors and windows helps slow the spread of fire and smoke throughout the building. Question 19. What does the letter E stand for in the fire safety acronym RACE? Option A, evacuate everyone. Option B, extinguish the fire if it is small, or evacuate the area. Option C, examine the equipment. Option D, enter the room with a wet towel. The correct answer is option B, extinguish the fire if it is small, or evacuate the area. The final step involves either putting out a small fire with an extinguisher or clearing the area if it is unsafe. Question 20. When using a fire extinguisher, where should you aim the nozzle according to the PASS acronym? Option A, at the top of the flames. Option B, at the middle of the fire. Option C, at the base of the fire. Option D, around the edges of the fire. The correct answer is option C, at the base of the fire. Aiming at the base of the fire allows the extinguishing agent to reach the source of the fuel. Question 21. What is the definition of a chemical restraint? Option A, a cleaning spray used in the residence room. Option B, a drug used for discipline or convenience that is not required to treat medical symptoms. Option C, A medication used to treat a specific infection. Option D. A type of physical exercise. The correct answer is option B. A drug used for discipline or convenience that is not required to treat medical symptoms. Using medications to control behavior rather than treat a medical condition is illegal and considered abuse. Question 22. What is an enabler device in a long-term care setting? Option A. A device that forces a resident to stay in bed. Option B. A device that limits movement but is used to promote independence, like a lap tray for support. Option C. A medication that makes a resident sleepy. Option D. A tool used to help the staff work faster. The correct answer is option B. A device that limits movement but is used to promote independence, like a lap tray for support. Enablers are meant to assist the resident with function, even if they incidentally restrict some movement. Question 23. How often should a nursing assistant check on a resident who is in a physical restraint? Option A. Once every hour. Option B. Every 2 hours. Option C. At least every 15 minutes. Option D. Only when the resident calls. The correct answer is option C. At least every 15 minutes. Frequent monitoring is required to ensure the resident is safe and has proper circulation while restrained. Question 24. How often must a physical restraint be completely released to provide care? Option A. Once per shift. Option B. Every 2 hours. Option C. Once every 4 hours. Option D. Only if the resident asks for it. The correct answer is option B. Every 2 hours. Restraints must be removed every 2 hours to check skin, provide movement, and offer toileting. Question 25. What is the most common and serious risk associated with the use of physical restraints? Option A. Increased appetite. Option B. Stiffness in the joints. Option C. Strangulation and death. Option D. Improvement in sleep. The correct answer is option C. Strangulation and death. Improperly applied or monitored restraints can lead to accidental entanglement and lethal results. Question 26. Which organization is responsible for protecting workers from hazards on the job? Option A. The Centers for Disease Control and Prevention. Option B. The Occupational Safety and Health Administration. Option C. The Omnibus Budget Reconciliation Act Committee. Option D. The Department of Health and Human Services. The correct answer is option B. The Occupational Safety and Health Administration. The Occupational Safety and Health Administration sets safety standards to prevent workplace injuries and illnesses. Question 27. What is the definition of contamination in an infection control context? Option A. The process of cleaning a room. Option B. The process of becoming unclean. Option C. The act of washing your hands. Option D. The process of healing a wound. The correct answer is option B. The process of becoming unclean. Contamination occurs when pathogens are introduced to a clean or sterile surface or area. Question 28. What is the most effective way to prevent the spread of healthcare-associated infections? Option A. Wearing a face shield at all times. Option B. Keeping the resident's door closed. Option C. Proper and frequent hand washing. Option D. Using double gloves for all tasks. The correct answer is option C. Proper and frequent hand washing. Hand hygiene is the single most important intervention in breaking the chain of infection. Question 29. Which precautions should be used when providing standard care to all residents? Option A. Contact precautions. Option B. Droplet precautions. Option C. Airborne precautions. Option D. Standard precautions. The correct answer is option D. Standard precautions. Standard precautions are the baseline for all care and assume all body fluids are potentially infectious. Question 30. What personal protective equipment is required for contact precautions? Option A. A mask and goggles. Option B. A gown and gloves. Option C. A respirator mask only. Option D. A face shield and cap. The correct answer is option B. A gown and gloves. Contact precautions protect against pathogens spread by direct touch or contact with contaminated surfaces. Question 31. Which type of isolation precaution requires the use of a specialized respirator mask? Option A, contact precautions. Option B, droplet precautions. Option C, airborne precautions. Option D, standard precautions. The correct answer is option C, airborne precautions. Airborne pathogens are tiny and remain suspended in the air, requiring filtered respirators like the N95. Question 32. What is the correct order for putting on personal protective equipment? Option A, gloves, mask, goggles, gown. Option B, gown, mask, goggles, gloves. Option C, mask, goggles, gown, gloves. Option D, goggles, gloves, gown, mask. The correct answer is option B, gown, mask, goggles, gloves. The gown is applied first to cover the uniform, and gloves are applied last to overlap the gown cuffs. Question 33. What is the correct order for removing personal protective equipment? Option A, gloves, goggles, mask, gown. Option B, gown, mask, goggles, gloves. Option C, mask, goggles, gown, gloves. Option D, goggles, gloves, gown, mask. The correct answer is option A, gloves, goggles, mask, gown. Removing the most contaminated item, the gloves, first prevents the spread of pathogens during the removal process. Question 34. What does the term musculoskeletal disorder refer to in healthcare? Option A, a disease of the digestive system. Option B, an injury or disorder of the muscles, nerves, tendons, joints, or cartilage. Option C, a type of mental health condition. Option D, a bacterial infection of the bone. The correct answer is option B, an injury or disorder of the muscles, nerves, tendons, joints, or cartilage. These disorders are common among healthcare workers due to improper lifting and repetitive motions. Question 35. Which bed position involves the head of the bed being elevated to 45 degrees? Option A, Fowler's position. Option B, semi-Fowler's position. Option C, high Fowler's position. Option D, supine position. The correct answer is option A, Fowler's position. Fowler's position at 45 degrees is standard for resting, breathing, and some treatments. Question 36. Which bed position involves the head of the bed being elevated to 30 degrees? Option A, Fowler's position. Option B, semi-Fowler's position. Option C, high Fowler's position. Option D, Trendelenburg's position. The correct answer is option B, semi-Fowler's position. Semi-Fowler's position is a lower elevation used for comfort and to prevent sliding down in bed. Question 37. Which bed position involves the head of the bed being elevated to 90 degrees? Option A, Fowler's position. Option B, semi-Fowler's position. Option C, high Fowler's position. Option D, Sims position. The correct answer is option C, high Fowler's position. High Fowler's is an upright sitting position used primarily during mealtimes to prevent choking. Question 38. How should you lift a heavy object using proper body mechanics? Option A, keep your knees locked and bend at the waist. Option B, bend at the knees and squat with a straight back. Option C, use only your arm and back muscles. Option D, keep your feet close together. The correct answer is option B, bend at the knees and squat with a straight back. Using the large muscles in the legs and keeping the back straight protects the spine from injury. Question 39. How often should a resident who is confined to bed be repositioned? Option A, once every 4 hours. Option B, every 2 hours. Option C, once per shift. Option D, only when they ask to move. The correct answer is option B, every 2 hours. Turning the resident at least every 2 hours is necessary to maintain skin integrity and prevent sores. Question 40. What is the medical term for the presence of blood in the urine? Option A, dysuria. Option B, nocturia. Option C, polyuria. Option D, hematuria. The correct answer is option D, hematuria. Hematuria is an objective sign of potential infection, injury, or disease in the urinary tract. Question 41. What does the term nocturia mean? Option A, painful urination. Option B, difficulty starting the urine stream. Option C, urinating frequently during the night. Option D, abnormally large amounts of urine. The correct answer is option C, urinating frequently during the night. Nocturia is common in the elderly and can increase the risk of nighttime falls. Question 42. What is the definition of dysuria? Option A, frequent urination. Option B, painful or difficult urination. Option C, sugar in the urine. Option D, the absence of urine. The correct answer is option B, painful or difficult urination. Dysuria is often a classic symptom of a urinary tract infection. Question 43. Which term describes the production of abnormally large amounts of urine? Option A, oliguria. Option B, polyuria. Option C, hematuria. Option D, pyuria. The correct answer is option B, polyuria. Polyuria can be associated with conditions such as uncontrolled diabetes. Question 44. Which term describes the production of a scant or small amount of urine? Option A, polyuria. Option B, hematuria. Option C, oliguria. Option D, anuria. The correct answer is option C, oliguria. Oliguria can indicate dehydration, kidney dysfunction, or a blockage. Question 45. What type of bedpan is used for a resident who has limited back motion or has had a hip fracture? Option A, a standard bedpan. Option B, a fracture bedpan. Option C, a commode bucket. Option D, a plastic basin. The correct answer is option B, a fracture bedpan. Fracture pans are smaller and flatter, requiring less lifting of the resident's hips. Question 46. What is a colostomy? Option A, a tube inserted through the nose into the stomach. Option B, a surgically created opening between the large intestine and the abdominal wall. Option C, an opening between the small intestine and the abdomen. Option D, a surgery to remove the kidneys. The correct answer is option B, a surgically created opening between the large intestine and the abdominal wall. A colostomy allows for the passage of stool into an external pouch from the large bowel. Question 47. What is the clinical definition of defecation? Option A, emptying the bladder of urine. Option B, the process of breathing in. Option C, the act of excreting feces from the rectum. Option D, the process of a wound healing. The correct answer is option C, the act of excreting feces from the rectum. Defecation is the final stage of digestion where solid waste is removed from the body. Question 48. What is a fecal impaction? Option A, the normal passage of soft stool. Option B, a severe stomach virus. Option C, the retention and buildup of hard feces in the rectum. Option D, the presence of gas in the intestines. The correct answer is option C, the retention and buildup of hard feces in the rectum. Impaction is a serious condition where stool is stuck and cannot be passed normally. Question 49. Which term refers to excessive gas or air in the stomach and intestines? Option A, emesis. Option B, flatus. Option C, flatulence. Option D, sputum. The correct answer is option C, flatulence. Flatulence can cause abdominal discomfort and distension. Question 50. What is an ileostomy? Option A, a surgically created opening between the small intestine and the abdominal wall. Option B, an opening between the large intestine and the abdomen. Option C, a type of heart surgery. Option D, a tube used to drain the bladder. The correct answer is option A, a surgically created opening between the small intestine and the abdominal wall. Because it bypasses the large intestine, the output from an ileostomy is always liquid. Question 51. What is a stoma? Option A, the bag used to collect waste. Option B, the surgically created opening seen through the abdominal wall. Option C, a type of surgical stitch. Option D, a blockage in the throat. The correct answer is option B, the surgically created opening seen through the abdominal wall. The stoma is the portion of the intestine that is visible on the surface of the skin. Question 52. How should a nursing assistant convert a clock times to military time for afternoon and evening hours? Option A, subtract 12 hours. Option B, keep the number the same. Option C, add 12 hours. Option D, multiply the number by 2. The correct answer is option C, add 12 hours. In military time, 1 p.m. becomes 1300 and 10 p.m. becomes 2200. Question 53. What is the definition of aspiration? Option A, reduced amounts of water in the body. Option B, difficulty swallowing food. Option C, breathing fluid, food, or an object into the lungs. Option D, the backward flow of stomach acid. The correct answer is option C, breathing fluid, food, or an object into the lungs. Aspiration is a dangerous condition that can lead to pneumonia or airway obstruction. Question 54. Which nutrient provides the body with fiber and its most basic source of energy? Option A, proteins. Option B, fats. Option C, carbohydrates. Option D, minerals. The correct answer is option C, carbohydrates. Carbohydrates like grains and fruits are essential for providing fuel for the body's cells. Question 55. Which nutrient is primarily responsible for providing a concentrated source of energy? Option A, water. Option B, fats. Option C, vitamins. Option D, proteins. The correct answer is option B, fats. Fats provide energy and help with the absorption of certain nutrients. Question 56. Which nutrient is essential for the growth and repair of body tissues? Option A, carbohydrates. Option B, fats. Option C, protein. Option D, fiber. The correct answer is option C, protein. Protein is the building block of all cells and is necessary for wound healing. Question 57. Which diet consists of foods that are transparent and liquid at body temperature? Option A, full liquid diet. Option B, pureed diet. Option C, clear liquid diet. Option D, mechanical soft diet. The correct answer is option C, clear liquid diet. Clear liquids like apple juice and broth are used when a resident needs minimal digestive work. Question 58. Which diet includes foods that are liquid at room temperature or melt at body temperature, such as custard? Option A, clear liquid diet. Option B, full liquid diet. Option C, bland diet. Option D, low sodium diet. The correct answer is option B, full liquid diet. Full liquid diets are more nutritionally complete than clear liquid diets. Question 59. What is the consistency of a pureed diet? Option A, liquid and transparent. Option B, thick and chunky. Option C, baby food consistency, smooth and blended. Option D, hard and crunchy. The correct answer is option C, baby food consistency, smooth and blended. Pureed food is designed for residents who cannot chew or have severe swallowing issues. Question 60. A mechanical soft diet is characterized by which of the following? Option A, liquids only. Option B, semi-solid foods that are easily digested and require minimal chewing. Option C, raw vegetables and nuts. Option D, spicy and fried foods. The correct answer is option B, semi-solid foods that are easily digested and require minimal chewing. Mechanical soft foods are chopped or ground to make them safer for residents with dental issues. Question 61. What characterizes a bland diet? Option A, high amounts of fiber and seeds. Option B, non-irritating foods served at moderate temperatures without strong spices. Option C, deep-fried and greasy foods. Option D, only very hot or very cold foods. The correct answer is option B, non-irritating foods served at moderate temperatures without strong spices. Bland diets are used to soothe the digestive system and avoid irritation. Question 62. When feeding a dependent resident, how full should the spoon be? Option A, 1/3 full. Option B, half full. Option C, completely full. Option D, it does not matter. The correct answer is option A, 1/3 full. Small amounts on the spoon allow the resident to chew and swallow more easily and safely. Question 63. What is the standard adult oral temperature? Option A 97.6 degrees Fahrenheit. Option B 98.6 degrees Fahrenheit. Option C 99.6 degrees Fahrenheit. Option D 100.6 degrees Fahrenheit. The correct answer is option B, 98.6 degrees Fahrenheit. 98.6 is the average normal temperature when measured by mouth. Question 64. What is the standard adult rectal temperature? Option A 98.6 degrees Fahrenheit. Option B 99.6 degrees Fahrenheit. Option C 97.6 degrees Fahrenheit. Option D 96.6 degrees Fahrenheit. The correct answer is option B, 99.6 degrees Fahrenheit. Rectal temperatures are typically 1 degree higher than oral temperatures. Question 65. What is the standard adult axillary temperature? Option A 98.6 degrees Fahrenheit. Option B 97.6 degrees Fahrenheit. Option C 99.6 degrees Fahrenheit. Option D 100.6 degrees Fahrenheit. The correct answer is option B, 97.6 degrees Fahrenheit. Axillary temperatures are typically 1 degree lower than oral temperatures. Question 66. Which thermometer tip color indicates that it is for rectal use only? Option A blue. Option B green. Option C red. Option D yellow. The correct answer is option C, red. Red color coding prevents the dangerous mistake of using a rectal thermometer in the mouth. Question 67. How long should you count an irregular radial pulse to ensure an accurate reading? Option A 15 seconds. Option B 30 seconds. Option C 1 full minute. Option D 2 minutes. The correct answer is option C, 1 full minute. A full minute is required to properly assess the rhythm and rate of an irregular heartbeat. Question 68. What is the normal resting respiration range for a healthy adult? Option A 8 to 12 breaths per minute. Option B 12 to 20 breaths per minute. Option C 20 to 30 breaths per minute. Option D 30 to 40 breaths per minute. The correct answer is option B, 12 to 20 breaths per minute. Normal breathing should be regular, quiet, and within the 12 to 20 range. Question 69. What is the normal range for a systolic blood pressure reading in an adult? Option A 60 to 80. Option B 90 to 120. Option C 130 to 150. Option D 160 to 180. The correct answer is option B, 90 to 120. The systolic pressure, the top number, measures the force when the heart contracts. Question 70. What is the normal range for a diastolic blood pressure reading in an adult? Option A 40 to 60. Option B 60 to 80. Option C 90 to 110. Option D 120 to 140. The correct answer is option B, 60 to 80. The diastolic pressure, the bottom number, measures the force when the heart is at rest. Question 71. What is a common clinical name for a pressure sore? Option A skin tear. Option B venous ulcer. Option C decubitus ulcer. Option D arterial wound. The correct answer is option C, decubitus ulcer. Decubitus ulcers occur when prolonged pressure blocks blood flow to the skin and tissues. Question 72. Which term refers to tissue death that causes the skin to become black and leathery? Option A cyanosis. Option B jaundice. Option C gangrene. Option D edema. The correct answer is option C, gangrene. Gangrene is a serious condition resulting from a lack of blood supply or severe infection. Question 73. When is the most appropriate time to apply antiembolism stockings to a resident? Option A, in the evening before bed. Option B, after the resident has been walking. Option C, in the morning before the resident gets out of bed. Option D, directly after a whirlpool bath. The correct answer is option C, in the morning before the resident gets out of bed. Applying stockings before the resident stands prevents blood from pooling in the legs. Question 74. What is a sitz bath? Option A, A bath where the entire body is submerged in hot water. Option B. A bath where the perineal and rectal area are immersed in warm water. Option C. A bath used specifically for washing a resident's hair. Option D. A cold soak for a broken limb. The correct answer is option B. A bath where the perineal and rectal area are immersed in warm water. Sitz baths are used to clean and soothe the pelvic area and promote healing. Question 75. In terms of skin health, what is friction? Option A. The layers of skin rubbing against each other. Option B. The rubbing of one thing against another, such as skin dragging across a sheet. Option C. A type of skin infection. Option D. The process of the skin getting older. The correct answer is option B. The rubbing of one thing against another, such as skin dragging across a sheet. Friction can damage the outer layer of skin and contribute to pressure injury formation. Question 76. What is skin shearing? Option A. The process of cutting hair on the body. Option B. When layers of skin rub against each other as tissue moves under the skin. Option C. The act of washing the skin. Option D. A type of allergic reaction. The correct answer is option B. When layers of skin rub against each other as tissue moves under the skin. Shearing occurs when skin stays in place while the underlying bone and tissue move. Question 77. What is eschar? Option A. A clear fluid that leaks from a wound. Option B. Black, leathery, dead tissue found in a deep wound. Option C. A type of surgical bandage. Option D. New pink skin growth. The correct answer is option B. Black, leathery, dead tissue found in a deep wound. Eschar must often be removed by a medical professional for a wound to heal. Question 78. What is slough? Option A. New muscle growth. Option B. Yellow or white stringy dead tissue found in a wound. Option C. A type of antiseptic soap. Option D. A surgical tool. The correct answer is option B. Yellow or white stringy dead tissue found in a wound. Slough is dead tissue that can interfere with the healing of a pressure ulcer. Question 79. How often should a resident's position be changed when they are sitting in a chair? Option A. Every hour. Option B. Every 2 hours. Option C. Every 15 minutes. Option D. Once a day. The correct answer is option C. Every 15 minutes. Frequent micro-adjustments are needed because sitting puts high pressure on the tailbone. Question 80. What is a prosthesis? Option A. A type of hearing aid. Option B. An artificial limb or body part used to replace a missing one. Option C. A special type of walker. Option D. A medical diagnosis. The correct answer is option B. An artificial limb or body part used to replace a missing one. Prosthetics help residents regain independence and function after losing a body part. Question 81. What is the primary goal of rehabilitation? Option A. To move the resident to a different facility. Option B. To restore a person to the highest level of functioning possible. Option C. To provide only comfort care at the end of life. Option D. To cure a chronic disease. The correct answer is option B. To restore a person to the highest level of functioning possible. Rehab involves multiple therapies to help residents recover lost skills. Question 82. What is restorative nursing care? Option A. Care provided only in a surgical center. Option B. Care that helps a person regain or maintain health and independence. Option C. Care that focuses only on medication. Option D. Care provided only to children. The correct answer is option B. Care that helps a person regain or maintain health and independence. Restorative care maintains the progress made during formal rehabilitation. Question 83. What is the first stage of the grieving process according to Elizabeth Kubler-Ross? Option A. Anger. Option B. Denial. Option C. Bargaining. Option D. Depression. The correct answer is option B. Denial. Denial is a defense mechanism where the individual refuses to believe the loss is happening. Question 84. What is the last sense to leave a person as they are dying? Option A. Sight. Option B. Hearing. Option C. Taste. Option D. Touch. The correct answer is option B. Hearing. Because hearing is the last sense to fail, staff should continue to speak to the resident with respect. Question 85. Where is the radial pulse located? Option A, in the neck. Option B, at the wrist on the thumb side. Option C, at the groin. Option D, behind the knee. The correct answer is option B, at the wrist on the thumb side. The radial artery is the most common site used for routine pulse measurement. Question 86. What does the term bradypnea mean? Option A, rapid breathing. Option B, slow breathing. Option C, absence of breathing. Option D, painful breathing. The correct answer is option B, slow breathing. Bradypnea refers to a respiration rate that is lower than the normal range. Question 87. What does the term tachypnea mean? Option A, slow breathing. Option B, rapid breathing. Option C, absence of breathing. Option D, difficulty breathing while lying down. The correct answer is option B, rapid breathing. Tachypnea refers to a respiration rate that is higher than 20 breaths per minute. Question 88. What is a pathogen? Option A, a helpful microbe that lives in the gut. Option B, a harmful microbe that can cause infection and disease. Option C, a type of medical equipment. Option D, a healthcare worker. The correct answer is option B, a harmful microbe that can cause infection and disease. Pathogens include bacteria, viruses, and fungi that cause illness. Question 89. What is the definition of asepsis? Option A, a severe infection in the bloodstream. Option B, being free of disease-producing microbes. Option C, the growth of bacteria. Option D, a type of physical therapy. The correct answer is option B, being free of disease-producing microbes. Aseptic techniques are used to keep residents safe from infectious germs. Question 90. Which factor of handwashing is most important for removing pathogens? Option A, the temperature of the water. Option B, friction. Option C, the scent of the soap. Option D, the type of paper towel. The correct answer is option B, friction. The mechanical action of rubbing the hands together physically removes germs. Question 91. On which side should a resident hold a cane for the best support? Option A, the weak side. Option B, the strong side. Option C, the side the resident prefers. Option D, it does not matter. The correct answer is option B, the strong side. Holding the cane on the strong side helps offset the weight from the weak leg. Question 92. If a resident has a weak left side, which side should you dress first? Option A, the right side. Option B, the left side. Option C, the strongest side. Option D, the side without the identification band. The correct answer is option B, the left side. Always dress the weak side first to make it easier to manipulate the clothing. Question 93. Where should a nursing assistant record a resident's fluid intake and output? Option A, on the resident's door. Option B, on the flow or graphic sheet. Option C, in the resident's personal diary. Option D, on the hallway bulletin board. The correct answer is option B, on the flow or graphic sheet. Accurate recording on the flow sheet is necessary for monitoring the resident's health status. Question 94. What is the clinical definition of atrophy? Option A, the growth of a muscle. Option B, the wasting away or decrease in size of a muscle. Option C, a type of severe headache. Option D, the process of a wound healing. The correct answer is option B, the wasting away or decrease in size of a muscle. Atrophy is common in residents who are immobile or have certain diseases. Question 95. How many milliliters are in 1 fluid ounce? Option A, 10. Option B, 30. Option C, 60. Option D, 100. The correct answer is option B, 30. 30 milliliters is the standard medical conversion factor for calculating fluid intake. Question 96. Why is there a small hole at the bottom of anti-embolism stockings? Option A, to allow the toes to breathe. Option B, to check the circulation in the toes. Option C, because they are made poorly. Option D, to help pull them onto the leg. The correct answer is option B, to check the circulation in the toes. Checking for color and warmth through the hole allows monitoring of blood flow. Question 97. When do most falls occur in a nursing facility? Option A, during the morning shift change. Option B, at night and after meals. Option C, during the lunch hour. Option D, only on the weekends. The correct answer is option B, at night and after meals. Reduced lighting and increased fatigue or confusion at night contribute to higher fall risks. Question 98. How should you describe the location of food on a plate for a visually impaired resident? Option A, by pointing to the food. Option B, by using the numbers on a clock face. Option C, by telling them everything tastes good. Option D, by moving the plate around. The correct answer is option B, by using the numbers on a clock face. Telling a resident that the meat is at 6 o'clock and the peas are at 2 o'clock helps them eat independently. Question 99. When is the best time to collect a sputum specimen? Option A, right before bedtime. Option B, first thing in the morning. Option C, immediately after a meal. Option D, in the middle of the night. The correct answer is option B, first thing in the morning. Sputum is more concentrated and easier to cough up after a night of rest. Question 100. What is orthostatic hypotension? Option A, high blood pressure when lying down. Option B, a drop in blood pressure when a person stands up suddenly. Option C, a rapid heart rate after exercise. Option D, a type of lung infection. The correct answer is option B, a drop in blood pressure when a person stands up suddenly. Moving residents slowly and allowing them to dangle prevents this dizzy sensation. Question 101. What is aphasia? Option A, the loss of the ability to walk. Option B, the loss of the ability to speak or understand language. Option C, a type of skin rash. Option D, the inability to swallow food. The correct answer is option B, the loss of the ability to speak or understand language. Aphasia is common in residents who have had a stroke or have advanced dementia. Question 102. What happens to a person's level of consciousness when they are in shock? Option A, they become very energetic. Option B, they may become confused or lose consciousness. Option C, they have no change in consciousness. Option D, they become very happy. The correct answer is option B, they may become confused or lose consciousness. Shock prevents the brain from receiving enough oxygenated blood, leading to mental changes. Question 103. Where should a Foley drainage bag be hung on a manual bed? Option A, on the side rail. Option B, on the bed frame. Option C, on the footboard. Option D, on the headboard. The correct answer is option B, on the bed frame. Hanging the bag on the non-moving frame ensures it does not pull on the catheter when rails are moved. Question 104. What units are used to measure blood pressure? Option A, milliliters. Option B, millimeters of mercury. Option C, degrees Fahrenheit. Option D, pounds and ounces. The correct answer is option B, millimeters of mercury. Blood pressure is always recorded in millimeters of mercury as a ratio. Question 105. How often should a nursing assistant check a resident's skin when a hot or cold pack is applied? Option A, once per shift. Option B, every 5 minutes. Option C, every hour. Option D, only when the pack is removed. The correct answer is option B, every 5 minutes. Frequent skin checks prevent accidental burns or tissue damage from extreme temperatures. Question 106. Which blood vessels carry blood away from the heart to the body? Option A, veins. Option B, arteries. Option C, capillaries. Option D, venules. The correct answer is option B, arteries. Arteries are thick-walled vessels that handle the high pressure of blood leaving the heart. Question 107. Which blood vessels carry blood back to the heart from the body? Option A, arteries. Option B, veins. Option C, arterioles. Option D, capillaries. The correct answer is option B, veins. Veins contain valves to help move deoxygenated blood back toward the heart. Question 108. What does the abbreviation ADL mean? Option A, activities of daily living. Option B, advanced dietary limits. Option C, average daily loss. Option D, ambulatory daily lesson. The correct answer is option A, activities of daily living. ADLS include basic tasks like bathing, dressing, and using the toilet. Question 109. What is the first step you should take when discovering a fire? Option A, call the fire department. Option B, remove the resident from danger. Option C, pull the fire alarm. Option D, close the windows. The correct answer is option B, remove the resident from danger. The rescue step in the RACE acronym is always the absolute first priority. Question 110. Which professional helps a resident with socialization and communication skills? Option A, the licensed practical nurse. Option B, the social worker. Option C, the surgeon. Option D, the chaplain. The correct answer is option B, the social worker. Social workers coordinate resources to meet the psychosocial needs of the residents. Question 111. What is the proper way to handle soiled bed linen? Option A, place it on the floor. Option B, place it in a soiled linen container. Option C, place it on a clean chair. Option D, shake it out in the hallway. The correct answer is option B, place it in a soiled linen container. Proper disposal of linen is critical for maintaining infection control. Question 112. How many kilograms are in a pound? Option A, 1 pound is 2.2 kilograms. Option B, 1 kilogram is 2.2 pounds. Option C, 1 pound is 10 kilograms. Option D, there is no difference. The correct answer is option B, 1 kilogram is 2.2 pounds. Weight must be converted accurately between pounds and kilograms for medical records. Question 113. What should you do if a resident says their food is poisoned? Option A, force them to eat it. Option B, ask if there is something else they would like to eat. Option C, tell them they are being silly. Option D, call the police. The correct answer is option B, ask if there is something else they would like to eat. Offering an alternative food choice shows respect and ensures the resident receives nutrition. Question 114. What is the first area to wash during a bed bath? Option A, the feet. Option B, the perineal area. Option C, the face. Option D, the back. The correct answer is option C, the face. Washing from the cleanest area to the dirtiest prevents the spread of bacteria. Question 115. What should you do before taking the oral temperature of a resident who just had a cold drink? Option A, wait 5 minutes. Option B, wait 20 minutes. Option C, take it immediately. Option D, use a rectal thermometer instead. The correct answer is option B, wait 20 minutes. A 20-minute wait allows the mouth to return to its normal temperature for an accurate reading. Question 116. What does it mean to be NPO? Option A, new patients only. Option B, nothing by mouth. Option C, normal pulse only. Option D, nighttime position order. The correct answer is option B, nothing by mouth. Residents who are NPO are not allowed to have any food, water, or ice chips by mouth. Question 117. What is the primary role of a nursing assistant? Option A, to prescribe medication. Option B, to perform surgery. Option C, to assist with basic care and gather objective data. Option D, to manage the facility budget. The correct answer is option C, to assist with basic care and gather objective data. Assistants provide direct care and support to the nursing team. Question 118. What is a beginning sign of a pressure sore? Option A, a deep hole. Option B, discoloration or redness that does not go away. Option C, a large bruise. Option D, clear skin. The correct answer is option B, discoloration or redness that does not go away. Identifying redness early allows for intervention before a full ulcer develops. Question 119. What should you do first when finding an unresponsive resident? Option A, start compressions. Option B, call for help. Option C, close the door. Option D, call the family. The correct answer is option B, call for help. Summoning emergency assistance is the priority when a resident is found unresponsive. Question 120. Which device is used to assist a dependent resident from a bed to a chair? Option A, a life jacket. Option B, a transfer or gait belt. Option C, a pair of handcuffs. Option D, a rope. The correct answer is option B, a transfer or gait belt. Gait belts provide a secure grip for the assistant to guide the resident safely. Question 121. True or false, alcoholism can be fully cured with medication? Option A, true. Option B, false. The correct answer is option B, false. Alcoholism is a chronic disease that can be managed but not permanently cured. Question 122. True or false, you should always knock before entering a resident's room? Option A, true. Option B, false. The correct answer is option A, true. Knocking is a sign of respect for the resident's home and privacy. Question 123. True or false, restorative nursing helps a resident maintain functionality? Option A, true. Option B, false. The correct answer is option A, true. Restorative programs focus on keeping residents as independent as possible. Question 124. True or false, it is okay to share a resident's medical info with their best friend? Option A, true. Option B, false. The correct answer is option B, false. Sharing info with unauthorized people is a violation of privacy laws. Question 125. True or false, a resident has the right to refuse a bath? Option A, true. Option B, false. The correct answer is option A, true. The Resident Bill of Rights includes the right to refuse any part of care. Question 126. True or false, you should use hot water to clean dentures? Option A, true. Option B, false. The correct answer is option B, false. Hot water can warp and ruin the plastic material used to make dentures. Question 127. True or false, a nursing assistant can tell a family the resident's diagnosis? Option A, true. Option B, false. The correct answer is option B, false. Only the nurse or doctor is authorized to discuss specific medical diagnoses. Question 128. True or false, cyanosis refers to a yellow color of the skin? Option A, true. Option B, false. The correct answer is option B, false. Cyanosis is a blue or gray color caused by a lack of oxygen. Question 129. True or false, standard precautions are used for all residents? Option A, true. Option B, false. The correct answer is option A, true. Standard precautions protect staff and residents from all potential pathogens. Question 130. True or false, you must always wear a mask for droplet precautions? Option A, true. Option B, false. The correct answer is option A, true. Masks prevent the inhalation of large respiratory droplets that carry germs. Question 131. True or false, an incident report is required if a resident falls? Option A, true. Option B, false. The correct answer is option A, true. Any unplanned event that results in potential harm must be documented. Question 132. True or false, range of motion exercises help prevent contractures? Option A, true. Option B, false. The correct answer is option A, true. Regular joint movement keeps muscles and tendons from shortening. Question 133. True or false, a nursing assistant may cut a diabetic resident's toenails? Option A, true. Option B, false. The correct answer is option B, false. Toenail care for diabetics is usually restricted to nurses or podiatrists. Question 134. True or false, incontinence is a normal part of aging? Option A, true. Option B, false. The correct answer is option B, false. While common, incontinence is not a normal physiological result of aging. Question 135. True or false, you should report if a resident hasn't had a bowel movement in 3 days? Option A, true. Option B, false. The correct answer is option A, true. Reporting irregular elimination prevents serious complications like impaction. Question 136. True or false, the last sense lost at death is hearing? Option A, true. Option B, false. The correct answer is option A, true. Continuing to comfort a dying resident through speech is recommended. Question 137. True or false, you should always use a draw sheet to move a resident? Option A, true. Option B, false. The correct answer is option A, true. Draw sheets prevent skin damage caused by friction and shearing. Question 138. True or false, hypertension is the term for low blood pressure? Option A, true. Option B, false. The correct answer is option B, false. Hypertension means high blood pressure, hypotension means low blood pressure. Question 139. True or false, you should dress the weak side first? Option A, true. Option B, false. The correct answer is option A, true. Dressing the weak side first allows for easier manipulation of the garment. Question 140. True or false, it is okay to accept a cash tip from a family? Option A, true. Option B, false. The correct answer is option B, false. Professional ethics and facility policies prohibit the acceptance of gifts. Question 141. True or false, you must always wear gloves for a pericare? Option A, true. Option B, false. The correct answer is option A, true. Gloves protect the assistant from contact with urine and feces. Question 142. True or false, the rectum is the most accurate site for temperature? Option A, true. Option B, false. The correct answer is option A, true. Rectal measurements are the closest to the body's internal core temperature. Question 143. True or false, you should never put anything in the mouth of someone having a seizure? Option A, true. Option B, false. The correct answer is option A, true. Putting items in the mouth can cause injury to the resident or the staff. Question 144. True or false, a Foley bag should be hung on the bed rail? Option A, true. Option B, false. The correct answer is option B, false. The bag must be on the frame to prevent pulling when rails are moved. Question 145. True or false, you should use a paper towel to turn off a faucet? Option A, true. Option B, false. The correct answer is option A, true. Using a dry towel prevents your clean hands from becoming recontaminated. Question 146. True or false, chronic illness refers to a sudden illness? Option A, true. Option B, false. The correct answer is option B, false. Chronic illnesses are long-term conditions with no known quick cure. Question 147. True or false, you should report a pulse of 120 beats per minute? Option A, true. Option B, false. The correct answer is option A, true. A rapid heart rate, or tachycardia, must be assessed by a nurse. Question 148. True or false, a resident who is NPO is allowed to have ice? Option A, true. Option B, false. The correct answer is option B, false. Nothing by mouth means zero intake unless specifically ordered otherwise. Question 149. True or false, you should use the acronym PASS for a fire extinguisher. Option A, true. Option B, false. The correct answer is option A, true. PASS stands for pull, aim, squeeze, and sweep. Question 150. True or false, semifowler's position is an elevation of 30 to 45 degrees. Option A, true. Option B, false. The correct answer is option A, true. This position is commonly used for resting and respiratory comfort. Question 151. True or false, you should report a blood pressure of 90/60. Option A, true. Option B, false. The correct answer is option A, true. Low blood pressure readings must be monitored to ensure the resident is stable. Question 152. True or false, a nursing assistant should follow the chain of command. Option A, true. Option B, false. The correct answer is option A, true. The chain of command ensures that care and concerns are managed by the correct supervisor.